You're not tuned in to HoustonHipHopNews.com. Report live from H-Town.
Yeah, we tuned in with HoustonHipHopNews.com. And we all in the mix right now, know what I'm saying, really spreading the positive word, speaking out, know what I'm saying, taking action. Foremost, we're going to let y'all know what's going on.
First of all, I want to say thank you to Wicked Cricket, to Ms. Hop here in Houston. My name is Ed Jones, a.k.a. Mr. Prevention from AHF, which is AIDS Healthcare Foundation. We are the largest in the world. We're in 23 foreign countries in 18 states. Hopefully by 2020, we'll be in 50 states. But our mission today here in Houston, I have met with this group here prior to today, and we did a phone call blast to your state congressional people that represent the Houston market. And calling these people today was in respect of asking the support for the bill that we've gotten placed on the floor, which is the H.R. 4260, which means patient equality from the Ryan White. And the Ryan White project itself, we're not asking the government for new money. We're asking the government to provide us with equal distributorship for the funds for the people throughout the United States. You know, the South has been hit the hardest with people moving from New York, moving from California, moving from the Midwest down to the South, and the South only gets a third of the funding that's available for those who are positive. And when I spoke with you originally with this group who was representing the people who are in need, I learned that Wicked Cricket was one of the first to help put together the hip-hop testing event here in Houston. I'm going to pass it over to Brother
I want to thank my man Ed and Miss Eva for involving me, because everybody know I've been dealing with the AIDS program ever since the early 80s. And what actually happened was, when I found out that the statistics of high AIDS was in 3rd Ward and South Park area, you know, I went to a clinic they had in 3rd Ward, and I was there for one situation, and I literally found out that they had a room in the back that people was going to, but they was trying to hide the fact about the AIDS situation, you know what I'm saying? The HIV virus, which if you catch it, you can still be treated. But a lot of people that just figured, oh, well, you catch AIDS, that's it, you die. And the virus itself could be treated, but the funding, they didn't literally have the real funding, and they didn't have the education about it, because they started thinking that if you get around somebody that had it, if they just touch you or something, you know, they literally were scared when they first heard it. They didn't have the real education about what AIDS virus, the HIV virus was. So they kind of hid it. So I started throwing block parties all over the city and calling the AIDS people to come set up a table and pass out condoms and literature. And I want to thank my man Cornell X for inviting me and a couple of lawyers and doctors to come out to a conference he did at Sunnyside Clinic, where I actually said, because it was all adult people there, but it wasn't any young people there. And we had a couple of radio stations there, so they were saying, well, how can we reach the young people? And I said, well, you literally would have to bring the artists that they want to see, and in order for them to see them, they would have to get tested. And, you know, I want to say what's up to all the radio stations that ran with it, but they had the power to do it. You know, it's not so much about who come with the idea, it's about the work getting done. So now that's just part of the work. The actual thing is, now that we got more people educated about it, we literally need more funding and more education about it. That's the main thing. You know, you got people that's lived at least 10 to 11 years that has it. But if people are not educated about it and not knowing that you can still live, then they gonna hide it. And as I can say for Ed has just literally taught me that over the years that I've been doing it, that they had a new condom, and he's gonna explain to you about the new condom. And not only about the new condom, that they got instantly quicker ways to test the AIDS. Excuse me, Eva.
Greetings. Yes, my name is Yvetta, First Lady Hop, Houston Operation Prevention. And I'm glad that everybody came and showed their support today and voted, called Congress. You know, nobody was shamed. We all did a good job today speaking out. So I appreciate Ed for Mr. Prevention for having trust and confidence in me. And thank you, Wicked Cricket, you know, for showing up and showing out today. So we're going to show y'all some condoms here, you know, that we're representing today. They even have AHF written on the back, so you know they certified, you know, Icon. These are the new Magnums, their version.
Where might they find them at?
Where might they find them? One moment.
Let me share this with you. We give condoms away. Just in Texas alone, we've given over almost 2 million condoms away. I gave the city of Dallas back in March. I gave them 1 million condoms to distribute among the communities with the health department for the need. I find in low and moderate income areas, a condom average anywhere from $1 to $2, depending on where you buy them and who you buy them from. And a lot of times people just will not purchase a condom because if we look at the demographics and the geographics, most of the low and moderate income neighborhoods, the stores are at least 1 mile between each other. So to walk to get a condom or go by the motel when they charge you 2 for 10 or 3 for 20, and you don't, that's all you have, and you don't have the money for the condom, you're going to go in and take the rest. That's just, we're just speaking of what we call the urban community language. Our company has a brand called Love, also Icon. Icon is in 2 different sizes. The Love is in the standard size. That's our Love. This is our Icon. We also have a silver Icon. Now, this is equal to what you call the Magnum. Quartered by space-wise, it's 1 centimeter longer, 1 centimeter thinner, and 1 centimeter wider. I demonstrated earlier that it was very durable, and you were able to put the whole entire condom over your hand if you need that much. And they laughed, but then they said, man, really, this is big, and it's extremely comfortable. But education-wise, we have condemnation, and condemnation has converted to education. A lot of our people in our community still use the term AIDS and HIV interchangeable, but I like for us to learn to use HIV. That is the very beginning stage of the virus. Now, some people are tested immediately and found to be at the status of AIDS based on their T-cell count. But once you become diagnosed as AIDS, you're never re-diagnosed as HIV. That's just something, just like if you go to prison and you're considered as an ex-felon or a felon, you will always be considered as a felon. No matter how high your viral load goes back up. Here in Houston, we have concentrated areas that need attention, and this team of people are willing to get the information out. We're going to get the condoms out, get the education out, and you ask me how much does a condom cost, just go to a speak out event, and we'll provide you with a condom. Those are free. We're really interested in making sure the communities across the country, especially the urban development community and high-risk communities, are treated equal. So we're not going to go to one city and charge for a condom and go to another city and charge. I really want to do a 5,000 setting of people to be educated before the first of this upcoming year, because there's a lot of myths still in the community. There's a lot of stigma. We're working on a stigma package right now to make awareness available, and updated education is definitely going to be free. It'll be the Cricket Hop, never know. Ms. Hop and Mr. Cricket, they might have all the independent school districts together, but we need to start educating at home. One of the biggest things I've learned throughout my travel, a lot of people say, my mama don't know. Our mama said, can you help me with my kid because I don't know what to say? Whispering. I think this is an issue that needs to be addressed openly. And then we have another issue. I would be raw if I could be permitted. In the hip-hop industry, we don't like to discuss the fact. We have trouble with the guys that say, my girl's okay, I'm okay, but you and your girl haven't slept with the same people all your life. And then we have the other issue. I'm a dope man. How am I going to be positive? I got bank. I'm not going to catch nothing. I got money to pay for. These are all the things right here. that come from us as a nation of people who in the industry, the hip-hop industry. And soon, and I will say, and very soon, we're hoping to come out with a nice piece of music with the different groups coming together to provide you with education and awareness. I want to say thank you so much, Hip Hop Nation, for being who you are. And now it's time for us to take up the banners to protect our community, not sell our community. And condoms, make sure you strap up. I don't have on hand, but I share this with you. We have female condoms, which our agency hasn't begun to develop yet for spending, but females, I'm going to say this to you. Pack it up. The brothers call wrap it up, but pack it up. I mean, put the female condom on, because if you get infected and you had an opportunity to protect yourself, that's on you. And it's sad to say, make sure that your partner is not positive. Both of you go test on first date if it's okay if you don't want to use a condom. They have what they call the dental dam. That's protection between the mouth and the vagina. They come in different flavors. They also have condoms of many styles, many flavors, but the flavored condoms are used strictly for flavor. Get you an icon. It'll show you much love. AHF, which is AIDShealthcare.org. AIDShealthcare.org. Or A as in Apple, H is in Henry, F is in friendly.org. You will find all the many different programs that we have. You can locate our clinics. We're working on hopefully coming into Houston real soon. We have the state-of-the-art of one-stop clinic and services. Also, we have a lot of fun sharing in the community. We involved in parades, hair shows, style shows, church programs, school giveaway, anything to get the message out to the people to help save. That's our mission, is to provide equally the care and the sharing love for everyone.